Hi everyone, my name is Janessa Fisher and I am a dental hygienist. I have my bachelor's degree in dental hygiene and I'm super excited today to talk to you a little bit about some oral health, about your oral health and about the oral health of your child or your soon-to-be child. So I'm making this video for people who are currently pregnant and or maybe have just had a baby and or have really little ones at home. So when you're pregnant, it's actually a great time to go and see the dentist to help reduce any infections or any oral disease that you have going on in your mouth. The safest time for that treatment is actually during the second trimester. That's when it's the safest for both you and your baby to have any x-rays taken, any treatment done. Now make sure that you do tell your dental professional that you are pregnant, as then they can discern which type of anesthetic to use and which will be best for you. The next thing that I want to talk about is when you've had your baby. So now you have this newborn baby, and between the ages of 0 and 6 months, they probably won't have a tooth yet. But it is still really important that you clean their mouth. One, it's just good to make a habit of it. And two, it does help reduce the amount of bacteria and plaque that's in your baby's mouth and help keep their mouth clean. The way you're going to do this is you're going to take a wet rag. You can use just water, and you're going to wipe out the insides of their cheeks, the ridge of their gums, and their tongue. That's it. It's pretty easy. Once they turn about 6 months, they're going to start teething. Sorry if it keeps you up all night. But sometime between 6 months and a year is going to be the most ideal time to take your child into the dentist for their first visit. Try not to go longer than a year. One reason is because we want to see how at risk your child is for dental cavities or dental caries. If they are at a higher risk, then we have different recommendations for you when you're cleaning your child's teeth. When the child becomes 6 months and they get their first teeth, you're going to start brushing and flossing. Make sure that you're flossing first, as flossing helps to remove the plaque from in between the teeth, leaving a clean surface for the toothpaste to come onto and to help repair any weak areas. When you brush your teeth, you're going to brush the child's tooth in small circles with the bristles angled up under the gum line or down under the gum line, depending on if you're doing the top teeth or the bottom teeth. You're going to continue to go in little circles and roll the toothbrush down to make sure that you hit all the sides. You're going to brush the outsides, the tops of the teeth, the insides, and make sure that you're getting even the back and fronts of the teeth. Now, when you're first starting out, it might be easier to have the child just lay on put their head on your lap and brush that way. If your child is at high risk, then the dentist might suggest that you start using a fluoridated toothpaste when you're brushing your child's teeth, maybe once a day and maybe twice a day, depending on how at risk your child is for cavities. From there, if the child also has a lot of cavities, they might suggest that you get on a fluoride supplement. When the child is young, they might just give it to you in form of a drop. They might, as the child gets older, give it to you in the form of a tablet for them to chew up. It's all going to be based on the child's weight and also on how much fluoride is present in your water locally. So make sure you're asking your dentist about whether or not your child should be on a fluoride supplement and if it's safe and ideal for your baby. The next thing I want to talk to you about is baby bottle mouth. So I know it's really common for parents to try and put their child down with a bottle. Now, one reason why this is not ideal is because both breast milk, and juice all have a high sugar content. And as this sugar sits on your teeth, it rots them pretty much. You can look it up, baby bottle mouth, and you'll see that it is gross caries most commonly across the top teeth. And the reason for that is when either the nipple or the bottle is put in the mouth, it sits on top of the tongue. And the tongue kind of helps to protect those bottom teeth, but it sits and almost rots them from the inside out of the top teeth. And then that can be costly, as you'll have to then put silver crowns on all the teeth. Or if it creates an infection, it can affect the permanent tooth growing underneath. If the tooth ends up needing to be pulled, it can cause some issues with crowding when your adult teeth come in. later. The last thing that I want to talk to you about is maybe the pacifier dropped on the floor and you just quickly pick it up and you put it in your mouth and rinse it off and then give it to the baby. Or you want to try some food, make sure it's not hot, and so you eat a spoonful and then you pass it on to your baby. Well, if as the parent, if your oral health is not in tip-top shape and you have maybe some cavities going on or even some gum disease, what can happen is the bacteria that causes those diseases can get put onto the pacifier or the utensil of any sort and then can get transferred into your baby's mouth and can cause the baby to have these conditions much sooner, or it might be more severe than what would have happened. So I just want to make sure that you are using water to rinse it off, or just not sticking it in your mouth before you pass that on to your baby. I hope that this has helped answer a few basic questions about oral health for you and for your child. Congratulations on your new baby, and I wish you nothing but the best of luck. Bye!